and grazes are common injuries that can usually be treated at home. A cut is a full break to the skin, whereas a graze is just the top layers of skin being scraped off. Normally, all you need to do is clean and dry the cut, apply some pressure and raise the injury. This should help prevent infection and stop bleeding. The wound should heal by itself within a few days. When treating a cut, always wear gloves if you have them, and first ask the casualty to apply some pressure to the wound using a piece of gauze. Just put some pressure on there and then raise the injury. Next, you need to clean the wound. And gently dry it. And finally, apply a sterile dressing. Just remove the gauze. Brilliant. Remember, apply pressure, raise the injury, clean and dry the cut, apply a sterile dressing. If you're worried about infection, ask the casualty to seek medical advice. And that's how we treat a cut or a graze. After an injury, it is common for somebody to get a bump or a bruise. Bumps and bruises may not appear straight away, but the skin can still feel painful, swollen and tender. Bumps are swellings under the surface of the skin, caused by fluid, and bruises are purple or bluish patches, caused by tiny blood vessels that burst into the soft tissue. Bruises usually change to a greenish or yellowish colour as they heal. To treat a bump or a bruise, you need to apply something cold to the skin. Can you just hold that on there for me? This will reduce the pain and help it to heal. If you haven't got an ice pack, you could use frozen peas or ice wrapped up in a cloth. But remember, don't leave it on for any longer than 10 minutes. If the bump or bruise is very painful, then ask the casualty to lie down and raise the injury above the level of their heart. This will reduce the swelling. If the bump or bruise becomes very painful or very swollen, then seek medical advice or go to hospital.
When someone is having a nosebleed, your priority is to control the bleed and keep the airway open. Help them to sit down, never lie down, and keep the nose above the heart to help to control the bleeding. Get them to lean forward, never backwards. This ensures that the blood drains out through the nose rather than the back of the throat, which may block the airway. Ask the casualty to breathe through their mouth and pinch the soft part of the nose. You can give them a pad to catch any blood that may drain out. After 10 minutes, release the pressure. Reassess. If the bleeding has not stopped, apply the pressure for a further 10 minutes. If the bleeding is severe, or if you have not managed to control the bleed after 30 minutes, it is time to call for an ambulance. So remember, get them to sit down leaning forward. Pinch the soft part of the nose. And if necessary, call for an ambulance. And that's how you treat a nosebleed.
So nobody likes to get stung. It's obviously quite uncomfortable. If you see a stinger there, good idea to try to get it out, either with the tweezers or sometimes if you take a credit card and rub it along the skin, it'll actually pull it out. So if a day or two later you start to see redness that's expanding and it's warm, definitely call your pediatrician or family doctor because you could have a skin infection developing.
Heat stroke is caused by the failure of the thermostat in the brain, which regulates the body's temperature. If someone has a high fever or has been in the heat for a long period of time, the body can become dangerously overheated. Heat stroke can develop from someone who is already suffering from heat exhaustion. Heat stroke can develop quickly with little warning, and the casualty can become unresponsive within a few minutes. Our priority is to try and cool them down as quickly as possible and get them to hospital, as this can be life-threatening. If someone has heat stroke, you may see some of the following signs: hot, flushed and dry skin, restlessness and confusion, a headache, dizziness or discomfort, a bounding pulse and high temperature above 40 degrees, or their level of response may decrease rapidly. If you think someone is suffering from heat exhaustion, help the person to a cool place and get them to lie down with their legs raised. Give them lots of water to drink, and you can also give them an isotonic drink to help replace the salt in the fluid that they have lost through sweating. Keep checking their level of response. If their condition seems to be getting worse, place them into the recovery position and call 999 or 112 for emergency help. So remember, help them lie down in a cool place, raise their legs and give them water to drink.